Now that we have discussed the skull bones, let's continue our look at the axial skeleton by investigating the vertebral column. So the vertebral column is also known as the spine or the spinal column. It consists of 26 individual bones that are referred to as vertebrae, and the vertebral column extends from the base of the skull to the pelvis. It's approximately 28 inches in length in the average person. And we saw that the skull was a rather rigid and immovable structure. The vertebral column is actually quite the opposite of this. It's not like this at all. We see that the vertebral column is quite flexible in that it's essentially linked to the bones, the vertebrae are linked together like a chain. And it also exhibits several curvatures which add kind of a spring-like property to the vertebral column. There are 5 major regions within the vertebral column, and each region has a unique set of vertebrae within it, as well as unique functions of those vertebrae. Beginning superiorly, we see that there are 7 vertebrae within the neck, and these are called the cervical vertebrae. Moving inferiorly, the 12 vertebrae that support the ribs are called the thoracic vertebrae. We have 5 vertebrae that are found in the lower back, and these are collectively called the lumbar vertebra. The most inferior part of the vertebral column contains 2 triangular-shaped bones. There's a large bone called the sacrum that is a triangular-shaped wedge that's found between the 2 pelvic bones. Its function is to transmit the weight of the vertebral column to the pelvic bones, and the fact that it is wedge-shaped actually helps prevent slippage between the 2 pelvic bones where it sits. Developmentally, the sacrum begins as 5 individual bones, so that's why they have the term 5 fused here in this diagram. In the adult skeleton, these bones have actually all fused together into a single bone, so developmentally they begin as 5 bones in the adult skeleton, which we're going to pay more attention to. In the adult skeleton, they have all fused together into a single bone. The coccyx is the inferiormost bone of the vertebral column. Just like the sacrum in the fetal skeleton, the coccyx begins as 4 separate bones that fuse together developmentally to become one single piece of bone. Its function is to provide some support for the pelvic organs, that is the organs that are cradled within between the pelvic bones. And the coccyx also serves as an attachment site for muscles on the posterior side of the pelvis. So now that we've introduced ourselves to the 5 major regions of the vertebral column, let's take a look at the vertebral column as a whole. When you view the vertebral column from the side, that is from the lateral aspect of it, we can see 4 curvatures. We have the cervical curvature, the thoracic curvature, the lumbar curvature, and the sacral curvature. Notice that these curvatures we don't see when viewing the vertebral column from either an anterior or posterior perspective. This happens to be an anterior viewpoint, but you can see it's nicely aligned and straight up and vertical. But if you view it from the side, it's not straight. It's got these kind of twisting and turning, almost kind of very mildly C-shaped curvatures that give it this kind of this S shape to it. These curvatures help to increase the resilience and the flexibility of the vertebral column, and so it allows the vertebral column to function as a spring rather than a single rigid rod or structure. Now, the vertebral column normally has curvatures associated with it, but it can also exhibit some abnormal curvatures. So some of these curvatures are congenital, so that is, they are present at birth and they are present developmentally, or they can result from disease, unequal muscle pull on the vertebral column, or even poor posture. One of these abnormal curvatures is called scoliosis, and scoliosis is an abnormal curvature of the spine in a lateral direction. So recall that the vertebral column has no lateral curvature in healthy individuals. We saw that looking at it from the anterior or posterior side, it was a nice vertical column. Scoliosis can result from unequal muscle pull on one side of the spine. That is, the muscles that attach to it can exert unequal amounts of force, especially if muscles on one side of the body are weakened in some way, or unequal limb length. That is, in particular, unequal lower limb length can result in in scoliosis and cause the spine to twist laterally. Kyphosis is an exaggeration of the normal thoracic curvature. So this is curvature, an exaggerated curvature in the thoracic region. Typically, it is caused by osteoporosis that erodes away the spongy bone that's found in the body of the thoracic vertebra. And this causes the thoracic vertebra to become crushed under the weight that they carry, and therefore results in an exaggerated thoracic curvature. So typically, this is why you see kyphosis in older individuals, because osteoporosis is a factor in this abnormal curvature. Lordosis is an exaggerated curvature of the normal lumbar curvature. So things like temporary lordosis is common in people who carry a lot of weight in their abdominal region. So this is pretty common during pregnancy, as the mother is carrying a little bit more weight in the abdominal region and causes the lumbar vertebrae to be pulled anteriorly. So we've seen normal and abnormal curvatures of the vertebral column. Let's generally talk functions for a second here. So the functions of the vertebral column are to support the skull. Within the middle of the vertebral column is the spinal cord, and so the vertebral column forms essentially the bony rings that surround the spinal cord and protect it. The very top of it, of course, is supporting the skull and the brain as well. The vertebral column also functions as a flexible spring, which permit and allow mobility in the neck, thoracic, and abdominal regions. And those are, again, thanks in part to really two things: the fact that the vertebrae are not fused together, but rather they are joined together by intervertebral discs, but also the curvatures that we talked about, the S-shaped curvatures from the lateral perspective are what give those are really two things that give the vertebral column the flexibility and the mobility that it has. With a few exceptions, all vertebrae have a common structural pattern. Each vertebra consists of a body, which is also called a centrum, and the body is located in the anterior part, so this would be facing the front of the body. And it has an arch-shaped structure, very appropriately called the vertebral arch, on the posterior side of it. The disc-shaped body is the weight-bearing region of each vertebra, while the vertebral arch is a composite structure that's formed of two pedicles and two lamina. The pedicles essentially form the junction between the body of the vertebra and the rest of the vertebral arch. And if you imagine kind of the vertebral arches as a house shape, the lamina essentially forms the roof of that house. So together, the body and the vertebral arch enclose an opening here called the vertebral foramen. So several of these, or I should say successive vertebral foramina of the whole articulated vertebral column form a long canal that's called the vertebral canal, and this is the canal in which the spinal cord is found. So the vertebral foramen provides an opening through which the spinal cord can occupy. So emerging from if we take a lateral perspective here, emerging from the superior and inferior aspects of the vertebral arch are the superior articular and the inferior articular processes, respectively. So on the superior articular processes are these smooth surfaces called the superior articular facets, and we see the same structures on the inferior articular processes. They have these smooth surfaces that are called the inferior articular facets. So the superior and inferior articular processes are the way that the the vertebral arches of adjacent vertebrae link up and connect to one another. We see that the inferior articular process of each vertebra, it's highlighted here in purple, forms a movable joint with the superior articular processes of the vertebra that's immediately below it. That superior articular process is highlighted in red here. So therefore, successive vertebrae join at their bodies. There's an intervertebral disc between the two bodies there, so they're linked up that way. But also the vertebrae are joined together at their articular processes here. We can also see in this diagram the superior and inferior articular facets where there's no vertebrae that are connecting here, but they've kind of removed them here just so you can see the structure. It's worth noting that the superior and inferior articular facets are the surfaces at which those joints are formed. So you can't see it right here between the red and the purple, but those two articular facets are coming together and forming a joint between those two adjacent vertebrae. On the lateral side of adjacent vertebrae are small openings that are called intervertebral foramen. If we want to refer to multiple ones of these, we call them intervertebral foramina. And it is through these openings that spinal nerves emerge from the spinal cord and make their way to various parts of the body. So now we've reviewed general features of the vertebrae. Let's take a look at some special features of the cervical vertebra. One characteristic of cervical vertebra is that they are typically smaller than other vertebrae, that is, their bodies, vertebral arches, and processes are generally much smaller than other vertebrae. And the reason for that is because they only need to support the head and the neck, so they're not carrying the weight of the body like the thoracic and lumbar vertebrae are. So therefore, they don't need to be as big. It would just be unnecessary for them to be much bigger than they are because the head and the neck don't weigh very much, respectively, compared to the rest of the body. So another characteristic is that we have these two, in their transverse processes, we see these two additional foramina. They're called the transverse foramina. So remember, foramina is plural. You would just say transverse foramen if you were referring to one of them. But we see that cervical vertebrae have two transverse foramina, that is, one transverse foramen on each transverse process. The transverse foramina, these are openings that provide protection for the vertebral arteries, which are a set of arteries that deliver blood to the brain. If we turn our attention now to the first and second cervical vertebra, we see that these both have special names, structures, and functions. The first cervical vertebra, which is usually referred to as C number 1 because the vertebrae are named or numbered, I should say, with the first letter of the type of vertebra that it is. So C for cervical, T for thoracic, L for lumbar. So C1 represents the first cervical vertebra. It has a special name, and its special name is called atlas. So this is a highly modified vertebra compared to the other cervical vertebra. You notice that it has no body, so toward the anterior side, this is where the body would be. There's no body on it. Towards the posterior side, there would typically be a spinous process, but we do not see a spinous process on it. Instead, what we really see is it's kind of ring-shaped, so it's pretty much just a ring of bone with these two large lateral mass pieces of bone on them. From this perspective, we can see the superior articular facets, and the superior articular facets are what articulate or connect with the occipital condyles on the occipital bone. So this is the joint that's formed between C1 and the skull here. The second cervical vertebra, or C2, also has a special name and structure. Its name is called the axis. It looks a little bit more like a typical cervical vertebra, with the exception of a structure on the body of it, or I should say that projects from the superior part of the body of it, called the dens. Now, the dens is a knob-like process that extends superiorly from the body of the axis. And the function that the dens plays is that the dens acts as a pivot point for the atlas. So if these two vertebrae were together, the dens would extend up and in between the vertebral foramen and rest at this little facet that you see here. And there's also a little ligament that kind of acts like a strap that goes around the dens and secures it to the atlas. So the dens essentially acts like a pivot point so that the atlas can rotate. Okay, so those are the specific structures of cervical vertebra. If we turn our attention for a minute to thoracic vertebra, the thoracic vertebra have all of the features of a typical vertebra with the addition of these facets here that are called the costal facets. So remember, this term costal means rib, and so these are rib facets where ribs will articulate with. Now there are 3 costal facets on each side of each thoracic vertebra. So that is, a single thoracic vertebra has 6 costal facets, 3 on the left side, 3 on the right side. The superior costal facets are found where the vertebral arch here meets the body of the vertebra. The inferior costal facets are found just inferior to the superior costal facets. And the transverse costal facets here are found on the edge of these transverse processes here. So this diagram actually shows how the ribs attach to costal facets. So the head of the rib, which is this expanded part right here, connects with the inferior costal facet the inferior costal facet here of the vertebra above that rib. That rib then spans the intervertebral disc here that you see, and also connects with the superior costal facet of the thoracic vertebra that's at the same level as the rib itself. We also see that the tubercle of the rib, that little knob-like projection, there's a little knob-like projection at the posterior and side of the rib, maybe about an inch or so away from the head of the rib. It's called a tubercle, and the tubercle of the rib makes a joint with that transverse costal facet of the same vertebra that we see the head of the rib attaching to the superior costal facet at the same level as that rib. So that's a little bit how the ribs connect to the thoracic vertebra. And kind of making our way down the vertebral column, I actually kind of skip over the lumbar vertebra because they don't articulate with any ribs, so they don't have costal facets, and they don't have the transverse foramina that we see in the cervical vertebra. So really the major defining characteristic of the lumbar vertebra is that they're large vertebra, really kind of specialized for weight bearing, since they're close to the base of the vertebral column. They're big vertebra that need to be able to support the weight of the body and transmit that weight to the sacrum. So recall that the sacrum is a wedge-shaped piece of bone, highlighted in yellow here, that's found between the 2 hip bones, which are highlighted in red here. While the coccyx, which is highlighted in blue here, is a small triangular bone that's found at the very inferior end of the vertebral column. Now, since all of the bones of the sacrum fuse together during development, we count them as a single bone in our count of vertebra in the vertebral column. The same thing applies for the coccyx, which also counts as one single bone. This brings our total count of the adult vertebra to 26. And recall that the sacrum's function is to transmit the weight of the vertebral column and the weight of the body to the hip bones. The coccyx functions to cradle pelvic organs or organs within the pelvic cavity here, but it also serves as a site for muscle attachment as well.